Hi everyone, my name is Prakash and I'm a third year medical student, and along with two of my other colleagues we have made this presentation as part of the Delta teaching series on how to become a surgeon. Today I'll be giving a short overview on the layers of the abdominal wall, starting with the skin and ending at the peritoneum. And we think this is essential knowledge for anyone going into surgery or emergency medicine, especially when it comes to understanding incisions, hernias and abdominal trauma. Now, the abdominal wall is a multi-layered structure that surrounds and protects the abdominal organs. It helps maintain intra-abdominal pressure. It assists in movement and breathing and provides a barrier against trauma and infection. The number and structure of these layers can vary depending on the region. For example, in the midline versus the flanks, but in general, the pattern is quite consistent. Now, this is essential knowledge for anyone going into surgery or emergency medicine, especially when it comes to understanding hernias, incisions, and abdominal trauma. Let's look at the layers from superficial to deep. And these are the skin, the superficial fascia, which has two parts, Camper's fascia and Scarpa's fascia. Muscle layers, which include the external oblique, the internal oblique, and the transversus abdominis, transversalis fascia, the extraperitoneum fat, and finally the parietal peritoneum. And we're going to go through each of these in a little bit more detail throughout this presentation. So let's first begin with the skin, which includes the epidermis and dermis, which provides the outermost barrier. Beneath the skin we have the superficial fascia, which is divided into Camper's fascia, which you can think of like a fatty layer, Scarpa's fascia, which is a more fibrous, membranous layer, and Scarpa's fascia is particularly important in surgery because it can be sutured and can limit the spread of infection. And now moving on to the muscular layers. There are three muscle layers that form the bulk of the abdominal wall. The external oblique, and its fibers run inferior medially, and think of it like putting your hands in your pocket. The internal oblique, where the fibers run superior medially, perpendicular to the external oblique muscle fibers, and the transversus abdominis, and those fibers run horizontally. And knowing the direction of the fibers is very helpful when it comes to determining which muscle is being penetrated. Now, the muscles also help with core stability, the rotation of the trunk, and increasing intra-abdominal pressure, which is important for things like coughing, lifting, and defecation. In the anterior midline, the aponeurosis of the three muscles we just spoke about form the rectus sheath, and this encloses the rectus abdominis muscle. Running down the midline is the linea alba, and it's a fibrous seam where these layers meet, and this is often used for midline incisions because it avoids muscle and the structure is relatively avascular. And there's also the arcuate line, which is found around the midpoint between the umbilicus and pubic symphysis, and this marks where the posterior sheath ends. Deep to the muscles is the transversalis fascia, a thin but strong connective tissue layer. It plays a crucial role in maintaining the abdominal wall strength, and is involved in certain hernia repairs. Beneath the transversalis fascia is the extraperitoneal fat, and this cushions and separates the abdominal wall from the peritoneum, and this space may contain small vessels and lymphatics, so it's good to be aware of this. Next is the peritoneum layer, the parietal peritoneum layer, and this is the final layer, and it's a thin serous membrane that lines the inside of the abdominal cavity, and it sits on top of the superficial organs. This structure is sensitive to pain, pressure, and temperature due to its somatic innervation. That is why when peritoneal inflammation, like peritonitis or appendicitis, is often very painful and well localized, and that's because of its innervation. Knowing the individual layers is essential for clinical practice. Hernias tend to occur at weak points in the abdominal wall, such as the inguinal canal or the umbilicus. Midline incisions through the linea albia are quick and bloodless, and facial planes are also important for placing laparoscopic ports and giving nerve blocks. And it's good to know that infections like necrotizing fasciitis can track along scarpa's fascia, so understanding this anatomy can be life-threatening. And to summarize, the abdominal wall has 6 key layers. From skin to peritoneum, each layer has a unique role, whether structural, functional, or clinical. And a strong understanding of this anatomy helps in everything from hernia repair to choosing surgical incisions and managing trauma. Thank you for listening.